Hey there, and thank you for joining me. Before I begin, I want to update on the bone density lab work that I got done. They sent me home with this huge jug I got to pee in for 24 hours. A little intimidating. I got to give it a little shake, put it in the fridge, kind of gross, but got to do what you got to do. They're testing for magnesium, calcium, and creatine levels. So we'll see how that goes. I'll keep you updated. So today I'm going to talk about questions and comments from my viewers on my YouTube channel. Without further ado, here we go. So we're starting with what happens if you stop taking HIV medication. This is from Michael Jones. I've been taking Triamec for 9 years and with no issues. Unfortunately, it's looking like I may have to go off due to the lack of access to care. The most peculiar part is, although I have private insurance, the communication between the mail order pharmacy and the doctor's office just isn't working. So I'll have to go into the doctor's office and visit, and it won't happen until near the end of October. Even under the best conditions, it's possible to lose access to care for different periods of time and various reasons like job changes or drug itinerary changes. I've been positive since 1998, and luckily the situation I'm speaking about has only happened 2 or 3 times to me. Cheers to the American healthcare system. Oh, what a bummer. Wow, I looked up the average cost in the US pharmacy, and I seen that it's about $3,100 a month, whereas in Canada it's only about $1,600. That's crazy to me, how the difference in different countries. The FDA approved this drug in 2014. And I see there's no generic form available. They probably have a patent still for a few years. So going on and off the medication can prove dangerous to your health. I mean, the virus could have resistance and the medication won't be as effective, and then you had to change that, and then you could have different side effects and so on. So I'm hoping you can clear that up. I wish you the best. There's also a person from China who's looking to move into Canada asking me recently if I have to pay for my medication, and he's wondering what province has different, depending on the province or state if you're in the US. And in my case, Ontario, I go through my private insurance, and once that is exhausted, I switch over to a government program called Trillium, and they cover the cost for the rest of the year. The only 2 things I got to do is do my taxes, and once I max out my private insurance, I got to send over limit to Trillium, and then that's it. I am thankful and grateful I have that service. I've never had interrupted my medication since I've been taking for 5 years now. So on to the next. Monkeypox in the media. This is from one and only Scott from Denver, Colorado, and this is myhivteam.com where he commented, not YouTube, but he saw the video. Thank you, sir, for adding me to your team, and yes, monkeypox is no different from HIV. When it started, it doesn't matter where the blame is. It's where the media loves to thrive on blaming it on gays all the time. But on the other hand, when it's here, it's here. And it needs to be recognized that when the virus is here, it doesn't matter where, what, or why. We just need to get it under control. He said, have a good day, sir, and thank you for your video. Another one for this is Insane UPS Driver. Love that one, and I've seen him around on my channel, and I'm happy that you're following me, because really, you're cool. I got into the argument with my dad the other day. Keep up the good work. He learned, air quotes. This is from the TV news, as well as he's very old and bigoted. P.S. Good to see you. You're doing well. Haven't seen you since you were on that talk show, which was Sally Jesse RBL, where it all began. So I'm thankful for you guys following me in this, and I'm hoping that by educating and sharing that maybe some views people might change for the better. So this is a lot of the reason why I'm doing these. So on to the next, my HIV diagnosis revealed. This is by Joyo V.M. Olivria. Wow, you're saying that you had only one exposure is pretty much in line with the most HIV plus people I know, who claim to be infected having only a single exposure. One of these people said is first time having sex, which brings us to the fact that maybe and probably all of the media analysis studies and show infection rates as low as 1.3% per exposure. Fundamentally wrong. And this is like capital letters, exclamation mark. This is trying to prove a point. I wish people knew that HIV infection rates are simply delusional. Well, there's many factors that go into this. I mean, somebody could not know their status and could be high viral load, and then the highest risk sex is unprotected anal sex, or sharing drug needles, but that's not in this case. So maybe the vaginal sex, that might be where 1.3% comes into play. It's difficult to put a percentage on exposure risk rates when there's so many variables in between. But thank you for sharing. This is from the video My HIV Symptoms Pre-Diagnosis by I Will Win. Hello, bro. I've done unprotected sex on May 17th. After 48 hours, I've taken PrEP for 28 days. On the 28 days, I had stomach upset and completing PrEP. I'm hoping you're still taking PrEP. I tested myself with RNA PCR test not detected. After that, a whole month, I had body and joint aches. The test that I had myself on August 20th, HIV combo antigen and antibody result was non-reactive. After 3 days, I did a whole STD test which shows I'm having chlamydia. I am still in fear that I have HIV. I have lost weight and body aches and stiff neck. I am in a lot of stress. And what I mentioned many times too is that stress can cause a lot on your health. You've already been diagnosed with chlamydia and you've dealt with that, and I'm telling you that HIV and acute HIV symptoms only usually, if you even get them, have them for about 14 days. So please try and calm down. There could be some other medical issue you have. It could be another STD, could be something completely different. So if you find out there's any other issues, please share with us. So moving on, this is from My Acute HIV Symptoms Answered, and this is from Game Fun. Hello, sir. I used a condom, but the girls touched the condom. After the next day, I had my body ache. In the 10th day, I got a sore throat that only lasted 2 days. After that, my stress and anxiety nearly killed me for the next 10 days, thinking I had HIV. I was regularly checking my body, searching the internet all over, day and night, getting more stressed, which again showed physical symptoms like fatigue, blurry vision, dry mouth, and then it slowly decreased, and again after 2.5 months I got a sore throat. I am very afraid, but I am only getting a sore throat with no other symptoms. Does touching a condom by a girl, by wearing it, transfer HIV? Now, that's a flat out no. You cannot get HIV on objects like a toilet or countertops, condoms, etc. HIV has a very hard time living outside of the body. It needs the entryway into the bloodstream. Information to educate is key for public health and also to combat stigma, which is alive and well today, as we see. I only included questions in the comments that were constructive for people. I've learned along the way from others, and I love to share. I enjoy making these videos, and I hope you took away something from it. So thank you for watching, and please remember to like and subscribe and tap that notification bell to be notified. Until next time, Michael K here. Take care, everyone.